In the month of December 2020, about 24.3 million PDE5 inhibitor pills were sold in the US. That's just 1 month, and this high number indicates that erectile dysfunction is more common than we think. This group of medication is the first-line treatment for erectile dysfunction alongside lifestyle measures. You might have heard big names like Viagra or sildenafil and Cialis or tadalafil. But which one is better and which one is the right for you? In this video, we will cover the similarities and differences between Viagra, Cialis, and Levitra. And at the end of the video, we will explain a meta-analysis that combines 16 clinical trials comparing Viagra and Cialis head-to-head. After watching this video, you will know Viagra and Cialis like the palm of your hand. With that being said, let's get started. When you get aroused, whether visually, physically, through smell or thoughts, nerves in your penis releases a tiny but powerful signaling molecule called nitric oxide. That molecule leads to production of other chemical messengers and mainly cyclic GMP or cGMP. These chemical messengers increase blood flow to the penis, and the result is a firm and nice erection. But an erection can't last forever, it needs to go away. And this is when PDE5 enzyme come into play, because it's break down the cGMP or cyclic GMP, and the erection is gone. In other words, cyclic GMP is pro-erection, and PDE5 is anti-erection. If we inhibit the activity of PDE5, aka anti-erection enzyme, erection will improve. And this is exactly what Viagra and Cialis do. They inhibit this enzyme. The enzyme can no longer break down cyclic GMP or cGMP. cGMP builds up in the erectile tissue and erection improves. Overall, they are effective in 65 to 70% of cases, and this efficacy is almost the same for both Viagra and Cialis. They all work in similar ways, improving blood flow to the penis by enhancing the effect of nitric oxide, which relaxes blood vessels and increasing their diameter. Consequently, more blood flow to the penis, and the erection becomes stronger and lasts much longer. There are some side effects that are common with all of these medications, all PDE5 inhibitors, like headache, flushing, nasal congestion, heartburn, and sometimes visual changes. And another important thing is that you should never take any of this medication with nitrates like nitroglycerin, which is commonly prescribed for chest pain or angina. The pill people with angina put under their tongues when they are getting chest pain. Because combining these two groups of medication can cause a dangerous drop in blood pressure, damage to multiple organs, and even death. The same applies to recreational purposes. You should also use caution with alpha blockers, certain blood pressure medication, and prostate medication. Your doctor might adjust the dose in case of liver disease or kidney disease. And in rare cases, they can cause priapism, or an erection that lasts more than 4 hours, and if not treated promptly, it will be your last erection ever, because priapism can damage penile tissue permanently. Very rare cases of hearing loss and vision loss are also reported. And these side effects are common to all PDE5 inhibitors, but each one has their own profile as well that make them different from each other. Let's start with Viagra, the classical and the oldest oral medication for erectile dysfunction, and it is still remain one of the most widely prescribed ED medication in the world. You usually take it about 30 to 60 minutes before sexual activity, and its effect lasts for about 4 to 6 hour window. That window is usually enough for a single encounter. And its absorption is affected by eating a heavy and high-fat meal, fried food, a big steak, or a large dinner. If you take the blue pill after meal with full stomach, it doesn't work. So, for the best result, you should take it on an empty stomach. And it's okay to take it early in the evening or even late in the afternoon, as long as your planned sexual activity remain within the 4 to 6 hour window. And there is no daily dosing option with Viagra. It's only available for on-demand use. Overall, it is best for men who want a fast-acting solution for a planned sexual activity. And now with generic version available, it is also one of the most affordable and reliable options. Some side effects that are specifically related to sildenafil are blue-green discoloration or change in the color vision. If that happened to you, you should stop Viagra and talk to your doctor immediately. And the other side effect specific to Viagra is nosebleed in rare cases. We put a lot of effort into scripting, recording, and editing these videos, but our channel is pretty small. If this video helped you even a little, give that like button a gentle hit and subscribe. It really helps us. Cialis or tadalafil is the more selective inhibitor of PDE5 enzyme, and it's often called weekend pill because its effect lasts for as long as 36 hours. That's almost 2 full days of potential responsiveness, and it is the best option for people who want to have multiple episodes of intercourse during the weekend. Cialis comes in 2 forms: on-demand pill and daily low-dose pill. On-demand pill is for planned sexual activity taken 30 to 45 minutes before sex, and the users remain responsive for good erection and intercourse up to 2 days. And the daily dose of 2.5 to 5 mg each day maintain a steady level of the drug inside your system, which means you don't have to think about taking a pill 30 minutes or an hour before sex. Instead, you are essentially always prepared. No timing pressure, no planning stress, nothing. That's why it's often preferred by men who have frequent and predictable sexual activity. You just take a small daily dose and maintain a constant effect in the background all the time. Another unique advantage of Cialis is that it can also help with urinary symptoms caused by an enlarged prostate, like urgency, frequency, and urine flow obstruction. For men who have erectile dysfunction and BPH at the same time, it can treat the 2 problems at once. But Cialis may cause back pain or muscle ache more often than other PDE5 medications. Other than Viagra and Cialis, there is Levitra or vardenafil, which sits somewhere around the middle. It takes 25 to 60 minutes to start working and lasts roughly about 4 to 5 hours. Almost like Viagra. But Levitra has one potential advantage: it's less affected by food, so it can be more convenient if you don't want to adjust your eating habits. Some studies also suggest that Levitra may work slightly better in men with diabetes or cardiovascular disease, although the evidence is still mixed. So Viagra gives you a short, defined window of about 6 hours for sexual activity, while Cialis can cover multiple occasions over 1 to 2 days, and Levitra is almost like Viagra but less affected by food. And choosing between Viagra, Levitra, and Cialis often comes down to personal response and how much flexibility you want. All 3 are highly effective, with clinical success rate of around 60 to 75 and sometimes up to 80%. But a massive meta-analysis, which is the kind of study that combines all the available data on one topic, looked at this exact question: which one is better, Viagra or Cialis? Researchers didn't just compare the 2 drugs casually, they compared sildenafil and tadalafil head-to-head. And they don't rely on one single question like how is your erectile function or so. They use detailed questionnaire digging deep into real outcomes, and even ask their partners for their perspective. They combine results from 16 clinical trials covering over 5,000 men. And what they found is that in terms of effectiveness and side effects, both drugs were almost the same, but more than 90% of users and their partners prefer tadalafil over sildenafil, maybe because of long-lasting effect, multiple episodes of intercourse with one pill, or so on and so forth. If you want to dive deeper into that data, I have put the link in the description. But choosing between Viagra and Cialis sometimes depends on your health, sexual activity pattern, and personal preferences. Men with high blood pressure often prefer Cialis because its gradual effect may help to avoid sudden blood pressure changes. For men with type 2 diabetes, Levitra may offer slightly better responsiveness, and older adults, let's say men over 60, may prefer Cialis for its long duration, which reduces the pressure of precise timing. Cialis can also help them with urinary symptoms because BPH is very common among this population. Men who prefer occasional use may choose Viagra or Levitra for their short and predictable effects. Ultimately, there is no one-size-fits-all answer. Your doctor is the best guide to balance benefits, side effects, medical condition, and lifestyle needs. And it is finally your doctor's call. Like the video and subscribe to the channel if you enjoyed the video. And if you do not enjoy the video, hit the dislike button twice to be sure and tell me in the comment why.